Inpatient beds and community care at Tregaron Community Hospital. Hywel University Health Board is inviting people to share their views about a proposal to remove 9 inpatient beds at Tregaron Community Hospital and replacing these with services for more people within our Ceredigion community. We hear from a patient, Jim, and his wife Jackie, who live elsewhere in Ceredigion and have received a variety of care and support at home.
They were there. I don't know what we would have done without them. And of course, with Jim being in hospital 3 times and coming out 3 times, you know, we wouldn't have been able to manage, would we? It was just absolutely horrendous what we went through. But without those girls, they were sort of like a saviour. They were there for us.
Once they settled in, I was quite happy. I would sooner be at home. I'm quite happy here. I know I'm sitting in bed doing nothing, but I'm quite happy at home. I couldn't be anywhere else. You know, I just didn't feel right in hospital. I know they were doing the job for me, but the atmosphere, it just wasn't right. When the physios and that came in, you know, helping me out with that, that was marvellous. But I couldn't move the next day after exercising.
We also hear from local healthcare professionals about how this could be better for our patients now and in the future. Meet Sian. Sian is a clinical lead nurse from Aberaeron. She shares with us her experience of caring for patients at home, about the model of care provided there and how she believes it makes a difference to patients.
Patients' feedback is that they prefer to be able to be cared at home. They don't want to be admitted to hospital. Our current nursing services work with all members of the multidisciplinary team, including GPs and Welsh Ambulance. Our main aim is to avoid hospital admission by ensuring that we send out urgent care practitioners to patients' homes so that they are assessed within their home environment, and then we're able to devise a treatment plan that involves the nursing services to wrap care around that patient and to keep that patient at home, avoiding any admissions to hospital.
Meet Sean. Sean is a GP in Tregaron. He talks about why he believes the proposed changes will help to improve the health and well-being of our communities, providing more joined-up high-quality patient care as close to people's homes as possible.
The team looking after the patient will include healthcare assistants, community nurses and ourselves as GPs. Patients will be provided with that care within their own home and be able to receive services like intravenous antibiotics at home and be able to have their condition dealt with without needing to access the hospital.
Meet Emma. Emma is a clinical lead nurse in Tregaron Community Hospital. She shares why she supports the proposed new model of care and how it could be of real benefit to our patients and staff.
The team in Tregaron Community Hospital is extremely skilled and capable. They deliver excellent care to a very small number of people. But if they could be released to support the wider community nursing service, we could be helping an awful lot more people with the wraparound care we could then provide.
Yes, they were absolutely wonderful.
We're inviting people to share their views on the proposal between the 1st and the 29th of August 2024. You can do this by visiting www.haveyoursay.wales.nhs.uk or by scanning the QR code below. Feedback from the engagement will be presented to the Health Board meeting in September 2024 for consideration before making a decision about the next steps.